But then when you talk about it and you go, oh yeah, I feel that, or I feel that, or I feel that, there's like, oh, okay.
Okay, we're
Oops.
live here, and I'm putting us on Facebook.
Okay. Good evening, everyone. This is coping during COVID and the new normal, brought to you by Mono County. And we are live here on this webinar and also live on Facebook Live at the Mono County Behavioral Health page. These are recorded so and uploaded later onto the Mono County YouTube and site, which we have a YouTube site, and also onto the website. And then they're also stored on the Facebook Live on Mono County Behavioral Health page as well. So if you want to catch up with us later, or you have somebody you'd like to share this with, you can. Tonight, we have a small group tonight. We're going to talk a little bit about how we're doing and how to just kind of keep us moving forward during this crazy time. And we have a Q&A. You can ask a question, you can make a comment, and please feel free to do that. We will respond to them. Also, if you're listening via Facebook Live, you can put a comment and we will connect with the comment as well. Oh, look, the sheriff's with us in her car, I bet.
Hello.
Are you in your
I
car?
am in my car.
Okay.
I'm in my car.
Hi,
So-
Ingrid.
Hi.
I thought I'd start us off with two things, and they're themes that I'm hearing from people, and then an experience that I had recently that maybe you can relate to, or maybe you can't. I don't know. It's hard to tell what's individual and what's more collective. So number one is I'm hearing people are tired and overwhelmed and kind of tired of it, and also caught in a place of limbo where maybe they've been vaccinated and they're not quite sure what they can do now, or they haven't yet been vaccinated and they're waiting. They're not quite sure how the process works. We can certainly explain all of that. But we're in this new limbo where our numbers are going down in terms of positive cases of COVID. That doesn't mean that people aren't still turning up positive. It doesn't mean that you still can't be exposed. All of those things are still true. It's still out there. It's just that we're on a downward cycle again, which we've done before, and still a time to keep practicing all the safe precautions that you can. Double masking because of the variants, washing your hands, not being too close to people, not being indoors, all of those things. It's still not clear through evidence whether or not when you're vaccinated you can carry the virus, or whether or not with that you could become ill from the virus, although it looks like you could, but probably not quite as bad. But we're not clear yet, like if I'm vaccinated, if I could be carrying it out in the world with me. So also important for people to double mask in order to make sure we're not spreading it and that we don't contract it. So we're tired of that. And I was recently had the opportunity to work remotely from a different county, and I spent 2 weeks away from home, and I was anxious all the time. I can't. So I think some of it was that I'm used to just being at home now, or in my county. I have a very, very, very small square that I participate in. I walk my dogs in. I go to the post office. I go to the market, and I just have like this square mileage from somewhere in Inyo to somewhere in Mono, and I hadn't been out of that for a year, practically. And then I ventured out into where there were people. Lots of people, lots more people than you ever see in Mono County at any given time. People I didn't know, people that were being safe and precautious and all of that, but still, nevertheless, people. And I really struggled with relaxing, in part because I feel like I've been on this, I call it tired and wired. You know, when you get so tired that you can't fall asleep because you're kind of wired. I just felt like that the whole time I was away.
That is a really,
Sorry?
yeah,
Tired and wired. Yeah, so anyway, I wanted to start with that. I don't know if other people feel that way. I know that Cassandra, you were out for a bit. I know that I don't know what you all are doing. I don't know if you're having a similar experience, and maybe you could have some words of wisdom for me for the next time I venture beyond my little square that I live in. But I imagine that since we don't know for sure that it's safe, and I don't want to harm anyone, that's my other bottom line. it was very strange. Go.
I guess I'll jump in. So my square is a lot bigger than Robin's square. And just given my situation with 4 kids and they're in school, I live in a part of California where my kids have been in school since November. I am a little bit at the different end of it where I am really ready to put this behind us in terms of, you know, I feel like it's run through a lot of people. I know that it's still out there. I know that people are getting vaccinated. I'm not loving this, you know, the vaccine and still have to do some of these certain protocols, which I know we still have to do because that is what we need to do. I don't love it. So I think that I understand with the Tired and Wired a lot. That makes a lot of sense to me. I feel the same way. We've got a lot going on. I feel like, you know, even when I try and settle down to kind of maybe, you know, wind down, it just doesn't happen. And so that's really kind of frustrating as well. And I think I agree about the limbo piece too. I kind of feel like, you know, there's a lot of, obviously there's been inconsistencies this entire time, right? And so
Right.
there's a lot of inconsistencies still, and it is one of those, you don't want to step too far, but then you also feel like you don't want to, how long are we going to do this? And so focusing on, you know, day to day, what we can do. I am very grateful that my kids can go to school every day. That's been a blessing for us, kind of having them some normalcy for them. So that's been helpful. But yeah, I understand what you mean. You know, and I have an aunt who sometimes joins this conversation, and she's very similar to you, Robin, and hasn't left her square. And you know, was over the other day. She's gone through both of her vaccines. Came over. We all wore masks. She hasn't been to our house in over a year. You know, sat far away distance. And it was just it was great to see her, you know, that way. But she was extremely anxious. And I was explaining to her that, you know, there's going to be a whole nother wave of, you know, this reintegration for people who haven't been out, and, you know, and what's that going to look like, you know?
Yeah, it's I feel like, at least in my role, I feel it's really important that I stay informed, you know, try to keep up with what's going on, and in some degree not taking the finger off the pulse. And so I don't know if you all saw this, but today the New York Times put out a video. It's about 15 minutes long, and it's nurses that are working in an intensive care unit, a COVID unit, that have GoPros on, and it's a montage of and stories of the patients and stories of the people who work there, and that didn't help. Feeling like, oh, we're kind of done. You know, like the part of me that knows that we're on the other side still, I have no idea how long that's going to be, but really not, it's not the same as looking forward to it in a way, and also looking forward to it. How about the rest of you?
Yeah, I mean, just to echo what everyone says, I think exhaustion is just, you know, a big word that we've been hearing, not just from everyone. I think it's just the exhaustion of just knowing that, not knowing what we should know, right? You know, keeping up with the CDC guidelines, keeping up, you know, information that is, you know, true, and as well as, you know, just even keep making sure that we're taking care of ourselves. I think that even just adds another thing to our plate. Yeah, like you mentioned, Robert. Yes, I was out of our county. I traveled out of state, and I had a lot of anxiety when I was traveling because I was very precautious of everything I was doing. You know, I came in with a hand sanitizer. I had my extra mask, my disposable mask, and I realized that our county is more serious on these, you know, guidelines. You know, when I was traveling out of state, you know, there wasn't much, you know, temperature check. People were, you know, not, some people weren't wearing masks, you know, and it's a whole new world out there. And it just made me more thankful of where I am at the moment right now, in our county. And, to know that there's people who still, are taking this pandemic, on a serious level. And I think that's what calmed me, I guess, in a little bit, just knowing that I'm taking my precautions, even though, I have both my vaccines, I'm still, making sure that when I traveled, I'm taking notes of my health. If I feel sick or anything, I need to stay home and stuff like that. So definitely, I think it's just, I feel like just knowing that I have to take all these steps, I think that's what makes me exhausted now with traveling.
Yeah, I mean, Cassandra, I can't imagine. It's like trying to imagine getting on an airplane right now. I really want to. I'm with Justin on that. Like, I'm ready to plan and, get out there and do stuff. But the actual thought, like, of, last time I got on an airplane coming home from DC about a year ago, and yeah, just wondering if it was out there, and now we know it was. But I think, one thing that's been really hard for me is you look ahead to you plan and you look ahead to milestones, and you reach the milestone, and it's just so much messier and complicated and not clear than you thought it would be. Vaccines are a good example of that. It's great. We've been able to vaccinate a lot of people, especially in Mono County. Our public health team has done a great job there, but there's still way more people who want to be vaccinated. They can't. I just got a text from my mom, my parents in their 70s and 80s in Orange County, and their second vaccination appointment got canceled because there's not enough vaccine, and
oh dear.
So 80-year-old people and get it, but we've been able to vaccinate a lot of people here, and there's some equity challenges around that, and I tend to hear that a lot in my job, and I'm just gonna say it's hard, and a lot of it isn't fair and kind of sucky. I think the people who are running it are trying to do their best, but so just that, like, think about how much we were like, wow, when we can just get vaccinated. And now here we are, and you're like, oh, I'm not vaccinated yet. My parents can't think, so that's a hard thing. And just, it seems that way right now. It has been kind of a tough week for me, and for other reasons, and even other things, like you reach a milestone, you do a lot of work on something, and you get there, and you still, then it's like, oh, now this other thing's going to happen. It's going to set you back and make things difficult. And yeah, so it's just, kind of these skills that we've developed,
it is
a good point about the, we sort of have seen these goalposts. I'll call them goalposts, or, these things that sounded like they were going to be great, and they are, but then they come with their own set of challenges that we never really anticipated.
So back in my younger years, I used to ride double centuries. So that's 200 miles in a sitting, if you will. And when I would train, I would ride centuries. Like I'd ride every weekend, sometimes 2 in a weekend. And the last probably 5 miles of any century, which is 100 miles, is always like unbearable. It's like the worst. And then when you do a double century, there's almost always a line painted in the street that says halfway there. And it would feel like halfway there. And so what is the difference, right? It's still 100 miles and you have 100 more to go. But there's it's like figuring out how to put a marker, like you're saying, a goalpost or a marker on that horizon. You go, okay, I got here. And now, yes, the horizon's still out there. And what's the next thing that we do, And I think part of what I was looking forward to tonight is just knowing that other people are maybe not struggling with exactly the same thing, but we're all kind of unsure of how we're going to proceed next.
Yeah. I see also one of our participants, Catherine, has her hands raised. I don't know if she has something she'd like to contribute.
Hey, folks, how you doing?
Good.
Good to see
Hi.
you all. Hello. I do have a question, since we have Stacy and Robin on, even though I like the medical opinion as well. We are going through this now in 2020, 2021, 22, and any good science fiction, horror, movie fan knows that scientists are always blowing off at the beginning of the movie and not listened to. And with the amount of permafrost, with the amount of glacial melt and viruses that humanity has not seen in 35,000 to 50,000 years, are protocols being developed now during this pandemic to handle the next pandemic that will probably not be more than 20 years out from where we currently are. Because if we can deal with what we are from a behavioral health standpoint now, it's going to give us better ammunition to deal with this again, say in 20 years. So I'd like to hear from Robin on the behavioral health side and Stacy on from the Board of Supervisors side. Thank you.
That is an excellent question, because what it reminds me of is the context that we're all doing this pandemic in is that it's going to be over, and then we're going to go back to eventually some form of life like we've all been used to, where we have all kinds of normal, terrible things going on in the world of humans. The climate is changing. I mean, here in Mono County, we're in a terrible, terrible drought. How do I think that we create ways of managing the stress of that are unconscious, because you kind of have to. It's like driving on a freeway. I grew up in LA. I learned to drive in LA. I know the freeways down there. And then when I was traveling, and I realized all of a sudden there were on-ramps. And I don't live where there's on-ramps for the most part. Like maybe there's 2 or 3, but there's on-ramps everywhere. They're like every quarter mile, there's an on-ramp. And there's people and I'm just not used to it, right? And so I realized, like, we build immunity to our environment that it can be very dangerous because we practice it on a daily level if you drive a lot. And then when you don't practice it on a daily level and all of a sudden you're put in that situation, I think you realize how stressful it actually is. That cars are speeding at 80 miles an hour all around you. It's amazing to me there's not more accidents, actually. So I think, Kate, what you brought up is a really good question. I'm hoping that within Mono County and all of in our processes, we do some debriefing as we get a little bit closer to, I don't know, but the end isn't the right way to say it, but we just get a little more stabilized perhaps, and we're not in urgency mode all the time, that we start to do a debrief on what we did and gain from that what we've learned, so that we can apply it to if we have a disaster or if we have another pandemic, or just how do we then help use what we've learned to create more wellness within our communities. I think that is something we could also learn, because the truth is we've done a really good job for the most part. It's been really, really, really hard, but I think we also saw the best parts of our community where we took care of each other. And not just in the short term, I think also in the long term. And I think that if it rises back up as we get out of this winter, which hopefully we'll get a whole bunch of snow, but when we kind of really look at what we look like in the next shoulder season, how businesses are doing, how employees are doing, how our community is feeling, I believe that we will rise up and meet the challenges that people are facing to the best degree that we can. But I don't know. Hopefully Supervisor Corliss has a better answer than I do. No, I'm teasing. But yeah, I think we have more to learn. What do you think, Stacy?
Learning is the key. Robin, this reminds me that we used to have a supervisor on the board, when every time Robin would come, he'd ask her how we shooter is. It's the same thing, right? Because it's a real problem and we know they're out there. And so what do we do? So we know, I mean, these climate disaster and the next pandemic, you're right, Catherine. We don't know what it is, but we know something's coming, and we know we need to work hard to prevent and mitigate. So I agree, debriefing, just learning, continually learning, and trying to build sustainability, you know, like how can we be ready? How can we create more resiliency in our community for the next thing, or you know, talk about it and not ignore it. That's one thing too. Know that, yeah, this morning there was a county training kind of on confrontation and avoiding, you know, like violence or anything like that. And one thing the trainer said, you know, you're not too often where, you know, you're looking for personalities and not behavior. So I think a lot of it too is observing, you know, if we focus on kind of trying to come out of this pandemic whole as we can be, and take care of people now and listen to people and address their needs now, we'll be better off for that scary sci-fi scenario. But worrying about it isn't going to help, but taking care of people is something.
Well, and Stacey, they want to know if you're going to be doing a 1-year anniversary community howl, bringing back your community howl.
Oh. Well, I guess we should. When would we do that?
Yeah.
What was the beginning? We all kind of began within a staggered couple of weeks, I think.
Yeah.
I created an event on Facebook. I guess I can go back and look.
Was it the 8 p.m. one? The
Yep.
howl? Yeah.
Yep.
I mean, it was the end of March. We started on social media, on Facebook, created an event, and we all.
Let's do something.
Okay.
We could start it here. We can howl here. Cassandra, what do you think? Or Ingrid, if you can still check in on the road, what do you think we ought to do around what we've learned here and what's coming? You have ideas?
Well, I mean, we talk about learning, and I think just, you know, moving on from what what we have done with our community. I think we are definitely still working on, you know, having that communication with our community and growing from it. You know, right now we're doing our, you know, coping with COVID at the moment. So, you know, listening to our community is the best that we can do and move on forward with that.
Mm-hmm. So if you are just tuning in, we are talking about how we're coping during this thing called COVID, which we're almost a year into at this point. February is almost over. And you can tune in here, or you can check us out on the Mono County Behavioral Health Facebook page. We do also simulcast, broadcast at the same time, live on the Facebook page. We have a Q&A here. You can type in a question. You can do it anonymously, a question or a comment. Or you can come on with us if you'd like to. We would love to hear from you. This is a community conversation. And how are you doing? We want to know. So I think what I'm realizing in myself is it's going to be easier if I can get deep rest to continue whatever is next. The question will be how I'm going to do that exactly.
Yeah. How are you going to do that? And then is your plan, Robin, to sort of slowly like take little steps forward into reintegration instead of sort of like that big leap that you just tried?
Yeah, so I'm going to venture back into working in the office a little bit here and there. I'm going to get my hair cut. Those are the first two things I'm going to try.
Yeah.
And you know, it's an interesting mix for me, and seeing friends outside. I mean, one of the advantages of having a pretty mild weather right now is when you're in the sun and the days are lasting a little bit longer. It's not that hard to be outside here, and so trying to get together in person with people, because I do notice that I do better personally when I have some in-person contact. Even if it, you know, like with your aunt coming over, it's mixed, it's still better than not having it. And, you know, just really paying attention to making myself do those kinds of things when sometimes it might feel better to just, when it seems easier, perhaps just be home and be like, I don't know, you know, because I don't know about you all, but I start thinking, you know, is it in the air around me? Like, not like, does that person have it or does that person have it? But, you know, when you're when you're going, like, for instance, when I go into the post office and you go through those doors, I'm like, is it between those two doors, like in that space? And like, I start getting wigged out about like where it is, as opposed to, I've gotten this far, I've done a good job, I'm doing fine. Most of the people I know are doing okay. I mean, I know people that are dealing with things that aren't related to COVID that are very affected by COVID. I have a good friend who had to have emergency surgery and nobody could be with, she's been in the hospital for a week, nobody can be with her. And how awful that is, and how hard it is to heal from stuff like that, and how stressful it is for her family. And I know other people who are going through things like that. So, and I need to make space for those folks in my life. Like, I also need to show up for them. I can't be telling people, like, I think you all, right? Like, you need to also show up for that stuff. And I have to take care of myself in order to do that. I don't know, it's just a lot of thought is going into just going outside, not outside, going to do a task, a normal task, like for you guys getting on an airplane. Like, I'm not a normal flyer, so that would always be a stressful event for me, not necessarily exciting, right? But even going to the post office, or I really need to get something at the Do It Center and I don't know where it is, so I'm going to be in there for a while looking for it, and I feel stressed out about that. And do I still need to be stressed about that? I don't know if I still need to be stressed about that. Who should I ask, you know? Like, well, that's a lot of work to just go get a bolt from my wheelbarrow. No, really. I mean, it's true though, right? Like, and I haven't done it. And I don't need a wheelbarrow quite yet. You know, the snow's still here, so.
Yeah. I mean, you don't want to have, I can imagine, we've talked about this all year, right? There's a certain level of risk everyone's, willing or has to take. You have, so everybody's is different. And so you don't want to have, done so well at protecting yourself for a year that now you go and you get it in the post office in between the two doors.
No, right. Exactly. Exactly. That's exactly right.
Yeah.
And I'm tired.
Yeah, I think it's fine. This reminds me, one book I'm reading right now is a memoir called Bravey by Alexi Pappas. And Catherine, maybe you, Catherine worked with some of our elite runners in Mammoth, and Alexi's an Olympic runner. And she's talking about, had a very traumatic childhood experience and struggled with depression. But she wrote about pain, and if you're one thing I love that made me feel better, she said all runners feel pain. That made me feel better because I'm not a very fast runner. But yeah, even Olympians, everybody's in pain, and so for her training, she really has to kind of make a plan around pain and discomfort. So even visualizing, hey, this is what I'm going to look like. I may, be an extreme, I'm just suffering, but yet I know my body can do it. I've trained for this. I'm an Olympic athlete, but she still has to plan for the pain. And Robin, it made me think, planning, it might not be real, physical pain to go to the hardware store, but it's discomfort. You're getting out of your comfort zone. So how do you plan for that? And like, okay, well, I'm worried about the space between the doors of the post office, but I also know if I double mask, my risk is really low. Right. And I've gotten vaccinated. So I don't know, even just making little plans for these little things. I mean, I do that. One thing that's helped me bust out of my comfort zone, I've been skiing more. I've skied, at the mountain, but cross country too. And you have to, encounter people and, okay, what's your plan going to be for putting your mask back on while you're fast downhill if you have to pass someone, so that you actually don't feel arm or something. So you just make these little plans for these moments of discomfort or unsurety. That's something that's helped me. And I loved the way Alexi in this book, Bravey, wrote about it.
That's a great. Do you guys, anybody remember who Greg LeMond is? The cyclist who from the Tour de France back in the day. He said something to the effect of what you're talking about, Stacey, that it doesn't get any easier, you just go faster, something like that. Like even if you're an elite athlete, you're still struggling if you're like a basic everyday runner kind of person. But you can go a lot faster. So I like that about pain. I'm going to be more mindful about these things.
I've also we've really taken stock of how important your health is.
Mm-hmm.
And I think that that's something you can control too. We all know that's something that you can control in terms of, how you eat and how you exercise and having the control over that to then kind of frees up your mind a bit to say, I'm doing everything possible that I can to make sure that I'm prepared or safe or, it is a little bit freeing as well. So we've been really focused on that quite a bit lately, which is
Cool.
good. Yeah.
Yeah, and if you think about it, a year ago at this time, not quite this time. So 11, 13, I'm not going to do the math right. After we've done through this a year, like we've really actually done quite a bit. We started there where we knew nothing, and it became really frightening. And it's still scary, but maybe it's not that scary. And that's what you all are saying. Like, I'm going to get myself together here and be a little more cognizant of what I'm thinking about and practice. Maybe I'll go to the post office every day for a while. How do you feel like your kids are doing with it, Justin?
It's really, again, they've been back in school since November. They wear the masks all day, but outside of that, they're feeling okay about it. What makes me very sad is watching them hesitate to touch people, hug their grandma, go up to people or stay far away, or, my 4-year-old putting a mask on. I hate all that, but I understand it, but it's just become a new norm, more of a normal for them than us. We've always talked about us kids are more adaptable. So, they've, I think, again, I can credit them being back in school has been really helpful for us. So that's good, but.
Because of the social and just the normal being around.
Honestly, I think the routine, the social, the getting out, we get up every day and they've got something they have to do and somewhere they have to be, and they get to see people. And yes, it's very, very different, but they didn't live 40 something years like, I have. So they don't have a ton of history of it being so different. So I think that's good. And I think that they're just the interaction with other people and lacking the connection with grandparents is tough and that kind of a thing.
So please add your questions and comments into the Q&A here on coping with COVID in the new normal. We're going to end at 6:15 tonight because some of us have to go on to the next thing that we've got going on. So we've got another 10 minutes. Stacey, you're frozen even though we can hear you, but you're frozen with a really perfect look.
I know, I was thinking is that a picture? But it wasn't. She just randomly froze, I think. Really.
I feel I'm frozen now, am I?
No,
it's her profile picture now.
It is. How sometimes you can freeze in a not so becoming way. You are very becoming at the. You're fine.
Now it's gonna switch to that. Yeah.
No, you're fine. I think the other thing that I do want to say that I have spent time. So my brother is a sixth grade teacher, and he and his partner came up and spent 2 different times with me, for one time for a month and the next time for 6 weeks. And I never would have spent time like that with my brother, ever. I mean, ever really. And so there's the advantage of that. I have a sister and one of her daughters who didn't get to do the next thing that she's supposed to do in her life. So they're going to come stay for a little bit. So there are some advantages of being able to take advantage of this time, right? And that I have really good internet here in Mono County. We're really lucky, those of us that have it, so that I could work, my brother could work, and then we would spend some time together afterwards. And that there is specialness, there is sweetness to this as well, I think. And that, again, I think we have a community that came together and continues to come together for other people. And I know some people are really, really, really struggling. And I hope that we can reach into you, or that if you have any of the energy to do so, to reach out, and that there is very clearly, I think we know what we're doing at this point, especially in my department, to be able to catch you if you need to fall for a little bit and provide as much help as we can. And then I'm going to work on my post office and go get my bolt for my wheelbarrow. And I miss eating out. I do. I miss being out with friends and just gabbing about.
I know that, yeah, the togetherness, the gathering piece is
Yep.
very difficult.
Yep.
Don't you think when we can do that again, or maybe as it's, hopefully I'm unfrozen, am I?
No, but you look fine.
Um,
You look smart and studious and thoughtful.
quick, somebody take a picture. Yeah.
Yeah.
But no, but don't, I think a lot, you know, talking about the feeling tired and wired, you know, when we'll have more opportunities to get together and, you know, meet with each other for a lot of us, for me anyway, I think that'll really help.
Yeah.
With the feeling of exhaustion, because it you up. It's very fulfilling. Just in the way, you know, the volunteering, it's great. You're helping someone else with something, but you feel so good after you. So I think, I hope individually and collectively that's the case, is we're able to be outside together more and eventually inside together again.
Fully agree.
Yeah, and I think I'm gonna, you know, on the milestones, it's, you know, it's probably a little bit to doing that visualization and realizing, you know, that that a milestone doesn't mean the race is over. That you might, but also it's not going to say that you have 100 miles to go. So, but it's just envisioning yourself getting through it. If I had this awesome picture of myself you guys keep talking about, that's what I would picture. It's like, okay, well, I feel pretty crappy today and might cry a little bit, but I'm going to have this nice picture of myself because I'm going to get through this and keep smiling and keep going and, you know, have a plan, use the tools I know help me get through the tough times and reach out.
Yeah, and like that, one of the things we had talked about in the past, which we have done, that's been really helpful, is we had talked about, and I think it was Ingrid, planning a trip, or maybe Linda, I don't remember, but someone was saying, you know, I'm going to plan a trip really far out, but at least giving me the something on my calendar and the ability to kind of plan for something and think, and we've done that, and that's been really helpful too. Something to look forward to, you know, realizing that, you know, hey, we're going to be able to do this at some point, and, you know, that was really good and helpful, and that was months ago. I feel like.
I think that was Beth, and I think that they were like researching all kinds of faraway trips that they never would have thought they would take, right? And
right.
Yeah, but I think we could all try that.
Yeah.
And so I want to just make sure that anybody who's listening or who might be listening later, like that we still are doing testing here in Monroe County. And we are also in the process of getting as many vaccines as I think we say it, as many vaccines to as many arms as we can. There is a process for that. You can go to the Monroe County website, monroecounty.org/COVID, maybe. I know I should know that, but so there you go, coronavirus. And it will lead you, but if you need help with it, if you can't figure it out or you need some help with it, feel free to call our department. We'll walk you through it, or you know, we have access to a computer. We can maybe help you over the phone or something like that. We can do it in Spanish and we can help in English as well. So making sure that people get in the queue for the vaccine if you're wanting to get it, now's the time. And it can be a little bit confusing sometimes. There's a new platform apparently, but we're here to help. And also there is still testing. So if you need to, or want to be tested, you still can here in the county. We've got stuff going on pretty much every day right now. Whether it's testing or vaccination. So please make sure that you're connecting with us as much as you can. We're here for you. That's what we're here for in Monroe County. Well, you guys want to call it a night and say we'll meet up again in April?
Sure.
Yeah. Thank
No,
you.
March. Sorry, March. I
Oh,
skipped
yeah.
right over March.
I don't think
Wait.
that was subliminal.
Ingrid, did you want to say something?
No, I haven't said anything the whole time because I'm driving, and it's hard to do this when you can't see the people. So it
Yeah.
just felt weird. But it was a really good conversation and really nice to listen to. So thank you for that. And I'm good with signing off and seeing you all next month.
Is it beautiful out there where you, on your drive?
It is. I'm taking Scenic Loop back in right now, and it's twilight, and it's really quite stunning.
Beautiful. We live in an amazing place, that's for sure.
Yeah.
All right, everybody, we'll see you in March. We'll get it posted so everybody knows when it's happening. Again, we are recording this so you can check it out. You can send it to your friends or family. You can give it as a gift if you know anyone having a birthday in March. Coping with COVID, the new normal. And thanks, everybody. Thanks, Cassandra, Justin, Ingrid, and Stacy, who had to hop off. It's always a pleasure to be doing this with you guys.
Thank you, everyone. Good night.
Thank you.
All right,
Night.
thank you.